Quinidine is used to help keep the heart beating normally in people with certain heart rhythm disorders, usually after other treatments have failed. Quinidine has not been proven to lower the risk of stroke or deaths. Quinidine is also used to treat a life-threatening form of malaria. How to use. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time it allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For regular short-acting oral dosage form tablets, for abnormal heart rhythm, adults 200 to 650 mg 3 or 4 times a day. Children 30 to 60 mg per kilogram, 30.6 to 80.2 mg per pound of body weight per day. Your doctor may increase the dose if needed. For long-acting oral dosage form tablets, for abnormal heart rhythm, adults 300 to 660 mg every 8 or 12 hours. Children 30 to 60 mg per kilogram, 30.6 to 80.2 mg per pound of body weight per day. Your doctor may increase the dose if needed. Contraindications: hypersensitivity to the active substance or to any of the excipients, hemolysis or hemoglobinuria, optic neuritis, tinnitus, myasthenia gravis. Quinine may cause severe respiratory distress and dysphagia in these patients, as quinine has been implicated in precipitating black water fever. It is generally contraindicated in patients who have already suffered from attack. Warnings: report the use of all other medicines, including herbs and supplements, to the doctor before receiving quinidine. Any possible interaction with other medicines should be ruled out. Use of this medicine can cause nausea, vomiting, diarrhea, loss of appetite, resulting in electrolyte imbalances. Use of very high doses of this medicine may induce abortion in pregnant women due to the oxytocin-like effect of this medicine. Use of the extended-release tablets form of this medicine is not recommended for children. Side effects: along with its needed effects, the medicine may cause some unwanted effects. Alternate of these side effects may occur. If they do occur, they may need medical attention. Less common: abdominal pain and/or yellow eyes or skin, blurred and/or double vision, confusion, delirium, disturbed color perception, headache, nausea or ringing in the ear, and/or visual intolerance of light, dizziness or lightheadedness, fainting, fever. Rare: chest pain, fever, general discomfort, joint pain, joint swelling, muscle pain and/or skin rash, nosebleeds or bleeding gums, unusual tiredness or weakness and/or pale skin.